I am Bharti Patel. I am the National Executive Director of the South African Federation for Mental Health. We focus on the human rights of persons with mental disability. We try to uphold the rights of persons with mental disabilities, and we try to achieve the highest level of mental health for all. As a national organization, the South African Federation for Mental Health works with stakeholders at an international level, a national level, and at a provincial level. This provides us with great opportunity to learn about good models that are practiced internationally, to be able to implement those models at a local level, but we also provide input to government. We provide submissions to national government in terms of policy decision making, and we are able to guide policy in the country. We also work closely with our 17 mental health organizations that are based in communities, and therefore we have a local footprint, understanding the needs of communities, understanding the needs of community-based organizations in terms of how they provide services, what the needs are in terms of making sure that mental health care users' rights are upheld. Community-based mental health care is critical to the well-being of mental health care users. When you find people leaving hospital after being treated, they are diagnosed and they have very little idea of how to manage their lives. So we look at reintegration into the community, and you need a whole lot of support around you to be able to fight the stigma.
South Africa's policies and legislation were definitely not geared towards dealing with something like a global pandemic. Even before the pandemic, our policies, our mental health legislation were not really being implemented effectively, and people who needed to benefit from it were not really feeling those benefits. One really important aspect is that the policy for emergency services didn't make provision for emergency mental health care. And I think that shows how mental health isn't always seen as a part of the response to crisis situations in South Africa.
Human rights for mental health is quite critical. We live in a democracy, but mental health has always been the least prioritized. South Africa is a signatory of the Convention on the Rights of Persons with Disability. Upholding human rights provides people with inherent dignity. And I think if we can see mental health care users as equal citizens, then we will be able to make sure that they get access to services, access to accommodation, and accessible to the rights that they deserve. Mental health is more than medication and diagnosis. It is about getting access to employment, access to housing and accommodation, to being able to live independently in the community. From a national point of view, we would like to see greater allocation towards community-based care. It is actually cheaper to provide care in the community. We need to see this as an investment rather than a cost saving. Within South Africa, we see that there is no parity in terms of subsidies paid towards community-based organizations. You will find in one province an allocation of 5%, and in other provinces less than 2% is allocated towards community-based mental health services. We find that almost 95% of the budget is allocated towards hospital services and very little towards community care.
Us in the mental health sector are hoping that we are going to see a review and a refresh of our mental health policy framework that lapsed in 2020. What we want to see is a policy that now takes into consideration things like COVID-19 and other challenges that might come our way. We want to see more resourcing, we want to see better implementation, we want to see the lines between national and provincial government becoming clearer in terms of accountability. Because of our decentralized model of governance, national develops policy, provincial implements it, but that line often is broken and the one doesn't speak to the other, and that leads to poor policy implementation. And those are the kind of things we want to see changed in the future. To better prepare a lower middle income country like South Africa for something like a pandemic, I think what needs to happen is that, yes, we want to obviously see more investment into mental health and we want to see better resourcing, but I think there needs to be a recognition that mental health is so much more than just something that sits in a bubble. Mental health is related to social services, medical services, emergency planning. It should be a part of everything. And I think for countries like ourselves to sufficiently prepare ourselves for crisis situations, we need to see that almost a mainstreaming of mental health where it becomes part of the everyday conversation. Whether we're talking policy, whether we're talking about contingency, emergency planning, mental health should be a core component of that at all times. One of the things that COVID-19 has meant for mental health is that it has to a certain degree normalized the idea of mental illness, or even if you don't have a diagnosed mental illness, it's normalized the idea of saying, I struggle with anxiety, I'm feeling stressed, I'm feeling isolated, I'm feeling fearful because of my physical health, my livelihood being under threat, my family, my friends being exposed to a potentially life-threatening virus. And so I think it's time for us to capitalize on that, to say, while it's okay to talk about mental health, let's do as much as we can at all levels of society, from government to grassroots level. Let's bring mental health out of the shadows. Let's break the silence. Let's fight to make more resources available, to make sure that mental health is on everybody's lips.
I want to speak my mind about the human rights of persons with mental illness. I want to speak my mind to make sure that we get greater investment for mental health. I want to see services accessible in the community. I want to see people enjoying their mental well-being and being able to ask for the services and get the correct services that they do deserve.